Hi, I hope you're all going to hunker down and stay safe tomorrow from the storm that's on the way. Before I go home from the clinic this evening, I'm going to do a treatment for these age spots on the backs of my hands. These are called solar lentigines or age spots or liver spots, and they're also called senile freckles, which is my least favourite term. They are not dangerous, but they're not attractive, and they happen particularly on sun-exposed areas like the face and the hands. They're commoner in fair-skinned people, and particularly as you get over 40. With any skin spots or lesions that aren't improving over time, you really need to see a doctor and get a diagnosis. One way to help prevent these is to wear a sunscreen. You can use creams like vitamin C or vitamin A, which will help lighten them a little bit. Things like hydroquinone or bleaching agents don't lift them. And what they are is clusters of melanocytes or pigment cells. They never go away on their own. They're not harmful. You can treat them with cryotherapy, which is liquid nitrogen freezing, but you've got to be very delicate with that so you don't go too deep and scar the skin. My favourite way to treat them is with BBL or broadband light from Sciton. What is BBL? It stands for broadband light, and it's a sophisticated version of IPL or intense pulse light. And like anything we see with technology, things just get better and better and more advanced over time. I like BBL because it's very comfortable. There's a cooling sapphire in it. It is a quick treatment. It's pretty pain-free. On a scale of 0 to 10, it kind of pings like a 1, and there's really no downtime. What will happen then over the next few days is these little pigment spots will darken a little bit, and then they'll just shed off as I'm washing and drying my hands. Got a little bruise here, but the rest of these are the age spots. But I'm going to use a clear gel. I'm going to be varying the intensity of the energy, which we call fluence, the pulse duration, which is how quick that energy is going to be delivered into the skin. And then I can change the temperature again, depending on the response I'm getting. The thing with IPL is it's not the same across different brands. It's not the same with different people using it. So if you're seeking any treatment, please see a really suitably qualified medical professional who's going to have a lot of experience with these light and laser-based devices. They're amazing tools, but we want to get the best result and we want to avoid any side effects. I've treated my left hand, and you can see already it's red, and sometimes you'll get a little tiny bit of swelling, and then those pigment spots will get darker before they clear. I'm going to now do some on my right hand, so trigger warning, here's some flashing lights again. This is the base, and we do a couple of passes of the base, and this will just give me a start on the treatment, and then I'll change to the specific filter for pigment. The thing I love about the Sciton machine is it's really fast and comfortable, and the technology is phenomenal. There's a huge amount of scientific evidence behind it, and I'm careful. I've been a doctor for 35 years, so I'm not going to be cavalier in terms of the treatments I do. I just want to see the evidence. I want to see the clinical studies. I will do treatments on myself if I consider them safe, particularly like this. I want my face skin, my neck skin, my hands, everything to be in sync so that I don't have a fresher looking face, an aged neck, and very aged hands. And it's all about just getting that nice harmony. I do understand I'm in a very privileged position to be able to do some of these treatments, and they're not cheap, but they can have a really nice improvement on quality of life. Do get in touch if you have any questions. Take care. Bye.